Thank you for being on watching Disability 24/7. My name's Christine Brown.
And I'm Kyle Pigman. This is a podcast by people with disabilities, for people with disabilities, and about disability issues.
Today we have two guests, Andrew Buck, who's a research scientist at The Ohio State University, and Taylor Richardson, who's a self-advocate, also been part of the Disability Experience Expert Panel. And our theme is mental health because this is Mental Health Awareness Month. Taylor, what is your experience with your disability?
So my experience with my disability, I have a mental processing disorder, and it does affect how I process information every day and how I interpret information and look at information overall. And I think that I guess for me, it would help if I have it helps if I have clear communication and clear specific instructions, because if I don't, it can confuse me and I will ask a lot of questions, tend to ask a lot of questions if I'm not understanding what I'm supposed to be comprehending. And it takes me a little bit longer to understand the information, what's been given to me. So it needs to be broken down into smaller tasks in order for me to understand.
And what has it been like being on the Disability Experience Expert Panel?
I think that it has been amazing being on the disability expert panel with Andrew Buck. I think that I really like that we are able to express ourselves and express our disabilities. And with that being heard, I feel like from Andrew, I feel like from him, as far as me having a processing disorder, I do love the extra accommodations and different ideas and different ways with the disability expert panel when it comes to research, how research can be accessible towards people with disabilities and not just people that don't have disabilities, but everyone in general. So I do like the different ideas and different solutions that we come up with within the disability expert panel.
Thank you, Taylor. This question will be going to Andrew. What training is happening to train professionals regarding mental health and IDD?
Well, the Ohio State University Nisonger Center's Building Bridges project, which is funded by the Administration for Community Living, is a statewide training initiative that's aimed at improving mental health services for adults with intellectual and developmental disabilities. The training uses the Extension for Community Healthcare Outcomes, or ECHO model, which brings experts and professionals together in an online platform like Zoom to share knowledge and build skills with each other through professional development. It consists of short content lectures and case studies that focus on unique or complex situations which involve serving adults with intellectual and developmental disabilities and mental health conditions. The training series consists of 6 to 8 week sessions that are generally 60 to 90 minutes long. And so far, we've conducted these trainings for mental health professionals as well as direct support professionals. And they're able to earn continuing education credits for their participation. Some of the topics include identifying mental health systems in adults with intellectual and developmental disabilities, a focus on anxiety specifically, application of team and trauma-informed approaches, crisis planning and prevention, supported decision-making, and using charting the life course to inform treatment plans. We're currently doing a series for DSPs, and we'll be scheduling another series for professionals in the fall. So people can learn more and access previous presentations and other resources on our project website, which is nisonger.osu.edu/buildingbridges. And recently I came across another good training program, and this is out of New Hampshire's USAID, their disability and health program. And they offer 2 free online healthcare education courses. that are available to health professionals. They also provide continuing education credits, and those modules teach healthcare professionals good practices and strategies to provide accessible, inclusive, disability competent care. And those are found at responsivepractice.org.
I'm up again. This is we know there's a mental health toolkit that was created, who worked together in creating it. How is it useful and for Andrew?
Thank you, Kyle. The Mental Health Therapy Toolkit was a product created through the Nisonger Center's Can You Hear Me Now project, and that was funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. And that project had three main studies. One was to develop and test an accessible self-report measure of health. The second was to interview adults with intellectual disability, as well as a chosen study partner to better understand the rate of mental health conditions amongst the population. And the third was to learn more about best practices for providing mental health care to adults with intellectual and developmental disabilities. Specifically, in that third study, members of our research team conducted a literature review to gather and summarize information that had been published in books and journals. And they also conducted group meetings with mental health professionals, as well as individuals with intellectual and developmental disabilities, to learn more about their experiences with the mental health care system and with mental health care providers. Through this process, the researchers were able to identify a list of effective practices, and they published a detailed report of practice guidelines to treat adults with intellectual disability and co-occurring mental health conditions. After that, members of the project's Disability Experience Expert Panel helped the research team translate that publication into a clear language summary. They also supported the development of a supplemental guide or worksheet that individuals can fill out to help their doctor or therapist know how best to support them and improve communication between patients and providers. And in fact, Christine Brown also developed a series of YouTube videos to help individuals work through that guide and fill out the worksheet to be able to give to their provider. So those guidelines include things like respecting the individual's ability to communicate in a preferred manner, practicing a trauma-informed approach to therapy, empowering the patient with self-determination and self-advocacy, teaching basic skills with accommodations and learning supports, and involving support persons with the consent of the patient to help with communication and practicing skills at home. You know, those publications are also found on our website, and this one is rrtcnisonger.org/mental health therapy, and you can also do a search for that, and we can provide links to these resources that I've been mentioning also probably in a video description as well. And, I think all in all, when we think about how this is useful, it's really useful in empowering patients to not only develop self-awareness, but importantly, to be able to use self-advocacy and explaining to their doctors how best to support them, and in improving communication with their providers directly from information that they're providing to them.
So, the next question is for you, Taylor. What has been your experience with mental health professionals?
So my experience with mental health professionals, it has been, in my opinion, a lot of challenges. As far as, since my disability is considered hidden and it's an intellectual disability, I find it very challenging for them to help me and to know how to help me best, just because it's not physical and they can't see the disability actually, and it's mental. So it's like a lot of, like, doctors, for example, they don't know how to help me because it's mental and they don't know how I process information, or they're not around me a lot to even know like, how I think or how I process information. So it's been like very difficult for me to try to explain to them like over and over again, like what my disability is, what types of struggles I have with my disability. Like I struggle with not some nonverbal communication, what I struggle with. Uh Executive functioning can be difficult for me, like executive functioning. As far as like in a work setting, that could be very difficult for me, like picturing and visualizing, like for example, like what a pizza looks like and how it's supposed to be cut. It's very difficult for me to visualize that compared to probably someone that doesn't have a disability. Um, I think that I just don't, I think I'm misunderstood a lot in the like mental health profession, when even like with my counselor, uh she's trying to like help me like to, and she's trying to understand me and get to know like how I think and process information now, but like I still think it's a struggle because it's mental, and I don't think that there's enough education or enough like enough professionals that even understand what the nonverbal learning disability is and how it affects a person on their day-to-day basis. Like for example, when I'm at the grocery store, or if I'm at places that have a lot of people, or if it's too much people, that causes a lot of anxiety for me. And when I'm like in the lines, just processing what they're telling me as far as the information, like how much things cost or how much in total what my groceries would cost, it takes me a little while to like maybe get out my money or get out my debit card if I'm like if I can't find it, or it takes me a minute like to just like understand basically like when it comes to math, as far as like how it came up towards like that total as far as groceries, for example, as a young adult with a nonverbal processing disorder. And sometimes I don't know if I'm asked questions, I don't know what types of questions to ask. If I'm new towards the subject, like very new towards, I don't know what types of questions to ask, or I don't understand what is being required of me as far as expectations, specifically like overall. And that also goes with school also. Like, and when I was in a classroom setting, like I wasn't just in the regular classroom setting, I was in like an IP room, so a separate room. And so it was a smaller class setting, which I do very well with one-on-one attention and smaller classroom settings. But if it's a huge classroom setting, it can cause a lot of anxiety for me because I'm trying to process the information. But I felt like in school, the information was so fast for me to comprehend, and they had to, as far as the curriculum, they had to move on, and they couldn't stay on the topic. So that was a huge concern for me and my parents. Like their huge concern, my concern was, and my parents' concern was, am I going to be able to move on to the next grade or move on to the next, like go to even like not necessarily college though, but like just graduate from high school or like preschool, or like as far as like that was their concern. Like would I be able to move on to the next grade? Because I did get held back, and I think it was my parents' decision. Because I felt like also too, as I got older, I felt like that was a good choice and a good option for me to get held back, because I wasn't understanding the information that I was like the reading, the math, the science was a struggle for me, like in school. And it took me a while to just comprehend it in a while. So I will say, to be honest, like it's been a struggle.
What could they do better in the mental health field? And this is for all of us to give our pointers, okay? So to me, I feel the mental health professionals need to know how to work better with us because, like you said, Taylor, everyone has their own um, different way of processing or feeling in the right environment. Some people may not feel good in one setting, and we have to work with them to make them feel good. So that is important that we focus on being patient centered and hoping that everybody can have the support they need. So, Kyle, we were talking about what could they do better. So the mental health professionals, what have you had in your experience?
I admit I still get anxiety at times, and I try to make sure that I do go um uh, to a couple people I trust, like my friend and second mother, Nevlin, and other people I can talk to. That's the for mental health, and also I still have my up days and I still have my down days, but I try to keep the most positive sense in the world. And I admit I'm kind of going off the topic here. I'm just more concerned about the funding for essential programs that could be cut in the federal budget. And I want to keep Nisonger and other centers like Nisonger around the country open. That's very essential. And I would appreciate you writing to your U.S. representatives and senators to keep the DD programs open for people with this and mental health programs, because they've talked about cutting mental health also.
Yes, I know it's a tough time, and we know that everyone deserves equal access. So Andrew, what could you say on your point of what could they do better? The mental health professionals. I know you said about the training, but any other thing you could say?
Yeah, engage with some training. And some of the key points that come out of trainings like this to develop more awareness and competency is simply using clear language and accommodations like models, videos, and visuals that can help support communication and comprehension. Um, Presume competence in your patients. I think people need to be able to trust and respect in everyone's ability to answer questions for themselves, to provide a self-report, and to ask for help or support if they need it. I think in some cases, when it is needed, you can work with a patient to identify alternative methods of communication or ask them to provide a demonstration or show you how they use their device, for instance, to communicate. But you can also ask for permission to involve a support person to help clarify or translate communication. And importantly, though, all of this is directed at the individual themselves and respecting their autonomy and their dignity. Lastly, a big pointer is just to be patient. When you ask someone a question, you have to allow them time to process and then respond in a way that fits their communication preferences and needs best, and allow time to build rapport in that relationship with someone to develop a mutual understanding of how communication is preferred and what support needs are required for two people to come together and understand one another.
Like Andrew was saying, I agree with him. I think that the mental health system overall in general does need to be a lot patient, a lot more patient with people that have disabilities and not so quick to cut them off as they're explaining information or they're trying to explain their story to you or what they go through. Because I feel like doctors, I feel like some counselors, and I feel like when you're working with people, they're quick to cut you off in a conversation because they don't talk that way or they don't communicate that way. So they're not as patient, like Andrew was saying, which I strongly agree with that because I deal with that a lot. And I'm pretty sure that you, Christine, and Cal deal with that too, as far as people not being patient with your communication style or how you communicate. And even they should encourage asking questions a lot more because I feel like asking questions nowadays is an issue And I feel like if you are asking questions, you're doing the right thing, but it's seen as a society, it's a bad thing to ask questions, especially if you're asking a lot of questions, because it's a part of my nature and my personality. And I love asking questions. I'm just naturally curious and I just like to know what I'm getting into clearly. And there's nothing wrong with that. But society makes it like there's a huge issue with that. And I don't know why and I don't understand that. And I think that's a huge problem as far as not building up communication, and it's not encouraging communication. It's just dwindling communication and decreasing it. And that's not going to help anybody.
Well, that's a very good point. And yes, it is so important that they have to focus on everyone's processing is different, and not trying to go off topic, but I'm pointing out that there are people with traumatic brain injuries and other things, so their processing is different too. Everyone, no matter who you are, has a different processing, and that's just human nature.
Yes, Christine, and I'm gonna let Andrew answer.
I think he already did.
I just didn't hear it. I apologize, but I'm grateful that I was able to talk about mental health, and it can, and we do, and they have the resources to, people with, for mental health, and to get help if you are struggling.
Yeah, thank you
So-
both for providing this opportunity to share this information out about our work and our experiences. This is obviously a great platform, not only to advocate, but to increase awareness and drive some of these changes in our communities. So thank you both for the work that you're doing and for inviting us here to speak in honor of Mental Health Awareness Month.
Thank you. You're
Welcome,
welcome.
and thank you,
Thanks. Thank you,
Andrew and
everybody.
Taylor.
Thank you.